There's a stakeholder for each of these decisions, and there are people that make money out of the way the health system is currently organized. So what you're talking about is people making less money in how the system is currently organized. So your ability to balance the interests of an industry and the interests of the American people is a political process that we just saw the ACA go through, but it's not so easy to announce that we're going to reduce the number of procedures, that we're going to pay less for certain kinds of procedures, that we want to average it out, because we're going to gore someone's ox in the process, and we're going to get pushback from interest groups and from a wide variety of people that actually, whether they like the system or not, they're making a lot of money over the way the system is currently organized.
Donna, politics is part of it, but that's not the whole thing. We need to have an educated citizenry.
Well, I
the
agree
reason
with that.
we
I
have
absolutely
less
agree with
smoking is because people now know about the effects of tobacco and all of the publicity around that. The tobacco companies are still just as active as they have ever been, spending as much money as they've ever had, but the number of people smoking is less than half the number in 1964.
And obesity is starting to come down as we work on that issue, particularly in relationship to children. And you saw the McDonald's report recently, these arrangements, the Clinton Foundation actually did some of them, with some of the food companies to get them to stop pushing sodas instead of milk. All of these are beginning to have an effect. I agree about the behavioral issues, but I don't think you can run away from the overall politics here.
Tommy Thompson.
It's not just the government. It's just not politics. It's the private sector. You want to really make improvements. Let's take a look at the healthcare system right now. There's tremendous improvements out there. Right now, we can have our EKGs taken in the back of our telephone. That's a private sector. It's education of the consumer as to what is best for them. We have to get that out. But let's not just leave it to the government. Let's take a look at some of the tremendous innovations. CVS, Walgreens, Walmart, all of those are involved right now in lowering the cost of healthcare because they're setting up clinics, nurses right inside the store. Why do we have to have dialysis put up have everybody go to? Why don't we teach people, have a nurse come into the house and have it done and hold down costs? There are so many wonderful things come out in regards from the private sector that can lower the cost of healthcare tremendously, educate the public, and move this forward. It's just not government that's going to solve this problem. The private sector is going to have a tremendous interest, and they're going to accomplish a lot more, a lot faster than the government system.
You're not saying leave it entirely to the private sector,
Oh, absolutely
or
not.
are you? Is that what you're saying? Yeah.
Absolutely not. But you're all talking about just the government. And I'm saying absolutely not. I'm saying the government's got a place. We got to start looking at it on a bipartisan basis. But let's also start encouraging the government to take a look at the private sector and allow the private sector really to start innovation. Pharmaceutical companies are coming out with some tremendous drugs. I'm on several boards with small companies. CR Bard is one. Some of our innovations on some of our devices are so far out there that you guys are all going to be just excited about when they hit the market. Are going to solve a problem. And that's taking place all over America. I'm involved with 25 small healthcare companies. Every single one of them has got a product or a device that's going to improve the quality of health and save money in the future. That's the direction of healthcare that we have to also encourage.
Kathleen Sebelius, are we not adequately appreciating what's going on in the private sector?
Well, I think that there's no question there has been an explosion of private sector activity. Certainly devices and drugs, we have led the way in this country for decades, and that's going to continue hopefully into the future. It's a terrible time not to invest in more research because we know a lot more now about the human genome. We know a lot more about the possibility of cures, and it's I think, a very stupid policy of the United States government not to double down on research dollars. But having said that, technology is finally hitting healthcare, and that's a very good news. The kind of improvements that we've seen in other service industries across this country, an explosion of trying to figure out how to make it easier for people to access services. That's going on in healthcare, and I think in a way that really can lower costs and improve care at the same time, and that's very exciting, and that's going to be driven by the private sector.
Yeah, we're